Well, there's two things I talk to every client about, and literally every client: keeping their pet at or near their ideal body weight and good oral health. And so good oral health comes with several components. One is detecting dental disease or preventing dental disease and doing some kind of daily oral care. So what I tell them is we have a new tool that allows us to actively look for infection early in the disease process, so we can do early intervention before we get full-blown periodontal disease and irreversible damage. So it's this early warning system that allows us to take the steps to keep their pet's mouth healthy. And besides what you can see on the outside as far as their teeth and having, what I call kissable breath, it's sparing all these internal organs from damage. So their pet, if they have good oral health, is going to live about 15% longer, which is an average of 2 years. A lot of times we've seen in the studies that 80% of dogs and cats have periodontal disease by the age of 3. But what pet owners don't know, and what the veterinary community doesn't know, that you can get periodontal disease as early as 5 months. And those are the recommendations from the American Animal Hospital Association, is to start looking for periodontal disease in that 5 to 9 month window. The good thing about OraStrip is it detects infection below the gum line, which you can't see on a visual examination. Well, when you're in the exam room, that's where everything happens. And it's one thing there's an old saying, tell me and I'll forget, show me I may remember, and involve me and I'll understand. I really look at that where you have visual confirmation of active periodontal disease. So right there in front of the client, there's not some hocus pocus that happens back behind closed doors. You don't come back and say the test showed us this. You can actually show them, perform the test with just a few seconds. And when they see that this dog has active periodontal disease, they're much more likely to accept your recommendations for professional treatment. Oh, Catcher, you're a handsome dude. How old is Catcher?
He's about 10 now.
He's about 10? Yeah, you're showing some of your signs of old age. Getting some of these little tags and stuff, that shows kind of the immune system is failing.
Okay.
One thing I want to start at the tip of the nose and end up at the tip of the tail. So the first place we're going to start is we're going to look here in the mouth.
Okay.
When you look here, we're always looking, 80% of dogs over the age of 3 have periodontal disease. We have a great new test that actually looks for the evidence of, when you look at them, you can't see what's happening underneath the gum line. Yeah. You can't see infection. So we have a great product here called OraStrip. It actually allows us to look for infection before it's visible to the naked eye. Okay, Catcher, this is going to be an individual strip we're going to use on you. So take out a fresh strip each time. Open it up. We're going to use this little pad right here. We're going to come down and rub it right along the edge of the gum line here. Let's start to notice one side here. You're missing a little tooth on the one part here. We're going to rub this right across the gum line right there. And then we're going to come over here. We're going to rub this right along the edge of the gums. Oh, that's good. Now we're just going to wait about 10 seconds here. We'll see the changes. And when you see the color change here, that's going to indicate active periodontal disease. So even if you look along the gums and everything looks normal, you can't detect infection below the gum line.
Okay.
So by detecting things early on, it allows us to initiate a treatment plan. And that way you can either prevent the progression of periodontal disease, or hopefully, like with puppies, we try to prevent it from even starting to begin with. Would you look right there, you can see the changes right there that's happening in this little pad. Yeah. We're here in between about a 2 and a 3. So definitely going to need a regular professional cleaning to get that plaque and tartar off. And I'm going to send you home with this test result.
Okay.
So it has details about periodontal disease, not just about what it affects the teeth and gums, but also about the heart, the liver, the kidneys. And if you need any more information, you go to yourpetsoralhealth.com, okay, which has a lot of other great information. And we'll put a little review here to come back in about 3 months.
Okay.
All right. The oral visual exam is not sufficient to diagnose active periodontal disease. And what happens is either the problem is underdiagnosed or is underestimated. So you don't know if it's happening or what the severity is. You can't detect infection below the gum line on a visual exam, period. Even the top clinician at the top practice in the country can't possibly look below the gum line to see that there is infection that is starting along the whole gum line or in an individual tooth. So here finally we have a diagnostic aid in the OraStrip that you can just simply wipe across the gum surface, get the fluids on there, and with just a few seconds you know if there's a presence of anaerobic bacteria. And the great thing is you can show it to the client. It's not something that has to be sent out to a lab. It's not something that's going to take an hour in the back. It just takes a few seconds to actually show the pet owner your pet has periodontal disease. And once you show them that, that's a great step then in getting them to accept your recommendations for a treatment plan.